In this video, we are going to talk about what you can expect when you have an S1 to S5 spinal cord injury. Listed above are the learning objectives. We're going to identify activities that you may need assistance with, as well as equipment that might be helpful to you, and give you an overall understanding of your level of function with an S1 to S5 injury. Some things that you will be able to do include being able to move your arms and hands normally. You'll have the ability to speak, breathe, and chew independently. You will be able to drive a car, but you might just have some specialized features that are added to it to help you with that. You'll learn how to use a manual wheelchair to get around your home and the community. You'll be able to use specialized braces and assistive devices to help you with walking and standing. And you might also have bowel and bladder control. What you can expect to be different is that you won't have full sensation or movement in your legs. When you leave the hospital, you might require the use of adaptive equipment to help bathe and use the toilet. As well as having somebody at home to help assist you, it would also be beneficial to have some various pieces of equipment at home. Pictured above is what we call a slide board. You might prefer to use this when going into an elevated surface, so like getting into the car would be a good example. Here it's placed between a wheelchair and the bed, so if you would like to go from those positions, then you would just place this under your thigh and bottom and scoot on top of the board. Once you're sitting on the mattress, you would remove the board, and that is one way that you'd be able to transfer independently. If it's applicable for you, we also have what's called a standing frame shown here. It's originally in a seated position. The person would sit down. Pads are placed at the front of the knee, as you can see, to help provide some additional support. And then the chair is slowly raised until the person is in a full standing position. There's a table at the top so that you can put your arms on the table, bear weight through your arms, do some of your daily activities, and just get your body used to that standing position. This is what we call a 3-in-1 commode, so you can use this as a toilet if you place it next to your bed. You would just attach this blue bucket here and slide it up under where the hole is located in the chair. Then the person can use the bathroom and the bucket can be dumped when finished. Or you could just place this chair over top of a toilet you already have. That way it makes the seat higher so it's easier to stand from. And there are 2 armrests on either side to help with if you're having any weakness in your core. We already mentioned how it's helpful to make the toilet seat taller, so this is just an example of a way that you could do that. This is called an elevated toilet seat, and this example does have rails on either side for the person to hold onto for support as well. We'll also recommend to install what we call grab bars. You can see these on the wall here. It's nice to have these next to your toilet and in the shower because it just gives you something sturdy that you know you can hold onto and that it will support you. Since your injury was in the lower spine in the sacral region, then you'll also be working with therapists to fit you for devices to help with walking and supporting yourself. So as seen here, you see that this man has on a brace on his leg, and he's also using a cane in one hand. So you will have therapists walking you through what kind of devices might be applicable for you. You can expect to be working with several different therapists and professions over your rehab journey. Some goals that we'll be working on with you will include frequent and proper pressure relief to prevent pressure sores and skin breakdown. We'll help with management of a bowel and bladder schedule. We'll work towards independence with bed mobility and completing your self-care activities. We'll also want to make sure you can transfer from several different surfaces, so from your wheelchair to the car to the couch to your bed. We'll help with your ability to use a manual wheelchair to get around your home and community. So this can look like navigating curbs, potholes, uneven surfaces. This will also include how to get from the floor to your wheelchair in the event that you would have a fall. We'll work with physical therapy as well with a standing and walking program where we can see what kind of leg braces would work for you and also decide what kind of mobility device is the most appropriate. And with that, that wraps up what we believe you need to know when you have an S1 to S5 spinal cord injury.